ventral surface of the medulla, and these two prominences are called the medullary pyramids. These house the pyramidal tracts. Remember, another name for the pyramidal tracts is corticospinal tracts. Okay? They're carrying somatic motor impulses for skeletal muscle movement. These pyramidal tracts cross somewhere right here above the spinal cord, above the foramen magnum. Where they cross, we refer to this as the decussation of the pyramids. Okay. Now, notice up here, what are these structures here?
The
optic nerves. Okay, and they cross here. The site where they cross is called the optic chiasm. And this little structure here would be, right behind the optic chiasm, would be the infundibulum. Another name for that is the pituitary stalk. The pituitary's been removed, but the pituitary would sit right here where my finger is. Okay? Now, as the optic nerves continue beyond the chiasm, they're called the optic tracts. Okay? If you have a tumor of the pituitary gland, it would be called a pituitary adenoma. What happens is, as it grows, it would compress the optic chiasm. And compression of the optic chiasm would result in a visual field deficit. We'll talk more about that. These two little, almost look like two little balls or two little structures behind the infundibulum here, these are called mammillary bodies. Okay. Now, what this is meant to show here, on the inside, this would be the thalamus on one side and the other. This would be the corpus callosum crossing over, and then this part in here would be the septum pellucidum. In fact, you can see kind of a cross section through the lateral ventricles. All right, if we turn over along the dorsal aspect, now along the dorsal aspect, particularly on this side, on the left side, a lot of this has been removed to show the inner aspects. Okay, so you're not going to see everything, but you can see here, here's the corpus callosum. This would be the septum pellucidum. You can see the two lateral ventricles, and this is the thalamus on either side. Okay. This would be here, behind the thalamus, this would be the pineal gland. And then you're going to have four bodies here. You see two on one side, the other two have been removed. These four bodies would be referred to as the corpora quadrigemina. The corpora quadrigemina consist of paired superior colliculi, those are the upper two bodies, and paired inferior colliculi. We said that the superior colliculi are involved in visual reflexes, inferior colliculi are involved in auditory reflexes. Okay. Now, I think that's mainly what I want to show you at this point. Okay. I want to show you something that it's important to look at these models during class today, and I'll tell you why. For some reason, this semester, we've had a tremendous amount of breakage in the models. For instance, someone broke this metal piece here that allows the brain to be put back together. And the way this broke is probably someone dropped it. And so we talked about this in the department, and what we're going to do is, for the more delicate models like this one and that one, and these are expensive too, we can't keep them in the annex. It's simply they're too expensive, and the students this semester just we're breaking models. We've lost a lot of slides. We're just not being careful enough. So make sure during class time that you look at these models closely, because we're not going to keep them in the annex. Okay. Let's look here now. Well, but I've kind of talked about this a number of times, but it's not improving. All right, let's start with this side. If we cut the brain in the mid-sagittal section, and you're going to do this today with the sheep brain, you'll see that the corpus callosum, okay, and this other band of white matter that comes here above the thalamus is the fornix. Now, this membrane right here is called the septum pellucidum. It separates the left ventricle from the left lateral ventricle from the right lateral ventricle. if we, let's see this guy here. You see the septum pellucidum here. Here's the corpus callosum. Here's the fornix. And extending between the two here is the septum pellucidum. It's simply a membrane, a partition, like the nasal septum that separates the two halves of the nasal cavity. In this case, it separates the two lateral ventricles. Below the fornix here, this is the thalamus. Notice there's a little focal area in the center of the thalamus called the intermediate mass. The intermediate mass is going to be the part of the thalamus that connects the left side to the right side. It passes right through the third ventricle. If we look at this model here, the arrow here was on that intermediate mass, right in the center of the thalamus. Now, this area below the thalamus would be the hypothalamus. You know that there's a stalk here connected to the hypothalamus, which is the pituitary stalk of the infundibulum, okay, from which the pituitary hangs. Now, let's go behind the thalamus. This would be the pineal. This would be the corpora quadrigemina. Okay. Notice that the corpora quadrigemina sits along the dorsal aspect of the midbrain. Passing through the midbrain here, this channel is the cerebral aqueduct. Recall that the third ventricle is a slit-like chamber located sandwiched between the two thalami. So fluid is going to pass from the lateral ventricles into the third ventricle, and from the third ventricle through the cerebral aqueduct to reach the fourth ventricle. Okay. This is the pons. Here's the medulla. From the fourth ventricle, fluid can either pass into the subarachnoid space around the brain, or it can continue down into the spinal cord through the central canal. Let's look at the other side.
Not enough storage, you're gonna have to get this one.
Here,
That's pressure.
here, now the septum pellucidum's on the other half, so there's no septum here. I can put my finger right into the right lateral ventricle. Okay, this is the right lateral ventricle where I'm placing my finger. Here we see the pituitary gland. Remember, it sits right posterior to it, directly posterior to the optic chiasm. This would be the optic chiasm. Okay. Now, ordinarily, what extension of the dura would sit between the occipital lobe and the cerebellum?
Falx cerebri.
Not the falx. The tentorium cerebelli. The tentorium cerebelli.
It's between the cerebellum and the what? Occipital?
Between the cerebellum and the occipital lobe.
He has a mohawk.
How you say
Okay.
it?
Tentorium, yeah.
This is the falx cerebri. Okay? This is a continuation or an extension of the dura that descends within a longitudinal fissure. It's going to separate the two hemispheres.
That's how deep it goes?
Yep.
That's broken.
In humans, that's how deep it goes. Now, if you look along its upper surface, you see the superior sagittal sinus.
That's the blue.
In blue. Okay? Now, if you look down, you see an extension of the dura that tends outward. This would be the tentorium cerebelli. The occipital lobes would sit above the tentorium. Below it would be the cerebellum. This little notch here is the tentorial notch. The midbrain passes through the tentorial notch to attach to the hemispheres. When the brain herniates, part of the brain is pushed through that notch. So when you take pathophysiology, you'll learn all about herniation due to increased intracranial pressure. It's when the brain then herniates through that notch. Okay? If you look down here, let's take this off. You'll see this on a sheep
Didn't know that
brain.
could happen.
You'll see that this is the olfactory tract. At its distal end, you'll see the olfactory bulb. The olfactory bulb sits right above the cribriform plate. Okay? So that olfactory axons, okay, which make up the olfactory nerve, pass through the olfactory foramina of that plate, and they synapse with secondary neurons within the bulb. Did y'all follow that? Okay, so the sense of smell is going to pass through a pathway, starting with the olfactory neurons, and they're going to synapse with secondary neurons within the bulb. You can see here the optic nerves passing through the optic foramina, or optic canals. Okay? These optic nerves are going to cross at the chiasm, and then they're going to give rise to the optic tracts. Here, I'll put a marker on here. This is the largest of the cranial nerves. This is the trigeminal cranial nerve 5. So you already know cranial nerve 1, the olfactory. You know about the optic nerves, that's number 2. And you know about number 5. So you're kind of gradually learning the nerves. Now, we cut here through the superior sagittal sinus, but notice here there are other sinuses as well that collect blood from the brain. This would be the sigmoid sinus. There's a straight sinus. But this venous blood from the sinuses drains into what blood vessel? The internal jugular. So the internal jugular is going to drain venous blood from the brain and carry it back down to the heart. All right. Let's look at this fellow here. I have a feeling he has things to show us. What do you think this is right here that we're seeing in cross-section here and here?
Sagittal.
Superior sagittal sinus. It's coming around like this. No, okay. Now we've kind of entered into the lateral ventricles. What are these bluish colored structures? Those are the choroid plexuses suspended within the lateral ventricles. Those are the structures that produce CSF. What are these two things here?
Frontal sinus.
Yeah, those look like frontal sinuses. All right, now in this transverse section, let me remove this tape. You start to pick up some additional structures. What do you think this thing is right here?
Optic chiasm.
Now, this is the internal capsule as it appears in a transverse view. And in fact, let's look at things here. This would be the thalamus. Remember, the thalamus sits along the medialmost aspect of each hemisphere. Lateral to the thalamus, we have the internal capsule. That's what we see here. Now, this is up here is the anterior horn of the lateral ventricles. Lateral to the anterior horn, these are the caudate nuclei, part of the basal nuclei. Remember, cannot put glue in a pig?
Mm-hmm.
So these are the caudate nucleus. Then lateral to the internal capsules, you have the putamen, and these are the two segments of the globus pallidus. Okay, so thalamus here in the center, in the midline. You have the internal capsule lateral to it. Then you have these anterior horns of the lateral ventricles. You see the posterior horns here. In fact, suspended within the posterior horns, these are choroid plexuses. Okay, so caudate nucleus, putamen, globus pallidus. Now, this is the midbrain. It's passing through that tentorial notch. I can recognize that it's the midbrain because it has these two little peg-like projections along its ventral surface. These are the cerebral peduncles. In this transverse section, you see a little opening along its dorsal aspect. What is that little opening? Cerebral aqueduct. Yeah. And then we're just catching the very top part here of the cerebellum as we're moving down. By the way, here are the globes. These are the eyes. What is this in yellow? That would be the optic nerves. Okay, now as we go further down, you pick up more of the cerebellum here. Okay, and you pick the tail end of the midbrain here. It still has the cerebral aqueduct. You're catching the tail or posterior aspect of the cerebral peduncles here. These are what lobes of the brain? Temporal lobes, right. Now, these are, do you know what these are? Ethmoid sinuses, yeah. And then we're catching the upper part of the nasal cavity, so this would be the nasal septum. And they're making models like this in sections so that you can correlate with MRIs. Okay, if we come back here, you're picking up more of the cerebellum. And at this point, we've lost the cerebral peduncles along the ventral surface. So it tells us now this is the pons. Number 22, this little space between the cerebellum and the pons, what is that space? Fourth ventricle. The fourth ventricle. That's correct. What would this be right here? Do you all see this channel here? External auditory canal. Okay, now we see more of the nasal septum here. And we're also picking up the maxillary sinuses. Okay. Now we're catching the inferiormost aspect of the cerebellum, and it looks like now we're catching the uppermost part of the medulla. So we're moving down the brainstem. Okay. Again, maxillary sinuses, this is the nasal cavity, this would be the nasal septum. Notice this is septal cartilage back here, whereas this is bone. Okay. Now, these blood vessels, this is the vertebra here. Okay. So this is probably either C1 or C2. But what are these blood vessels that are traveling within the transverse foramina? Not intervertebral, these are vertebral arteries. Okay? And then number 21 right here, these are the internal jugular veins. The blood that's traveling within the sinuses drain into this internal jugular. And then right here, these are the internal carotid arteries. So remember when we saw at the base of the skull and we said, okay, the carotid canal sits anterior to the jugular foramen. So in the same way, the internal carotid artery is anterior to the internal jugular vein. Okay, so that they're going to pass through the base of the skull through those two openings. Okay. Now,